So hello, let's discuss an MCQ related to the JVP, that is the jugular venous pulse. So pulse is an intermittent expansion of the artery or the vein. Both are actually known as the pulse. Here these are the venous pulse. So in that C wave occurs when there is an onset of atrial systole, AX descent, atrial relaxation, VY emptying of the blood from the right atrium into the right ventricle, and YA ascent filling of the right atrium from to the vena cava. So let's find out which is wrong in this condition. So for that we all need to understand JVP, that is the jugular venous pulse, which we get into the internal jugular vein when the person is sitting at the 45-degree angle, and we see the highest pulse which is visible onto the jugular venous. We take the two scales and then we record the pulse in the centimeter. But when we record his pulse pattern, we get three positive waves and the two negative. What are the positive waves labeled as? Positive waves labeled as the A, C and the V wave, and the negative waves labeled as the X and the Y. So when there will be the positive wave, so obviously these jugular vein actually represents the right atrium. So as the right atrial pressure is increased, we get the positive wave. And when the atrial pressure is going down, we get the negative. That is the simple concept. So what are the conditions during which the atrial pressure will be increased? So first thing, we also need to understand into the cardiac cycle. If the person's heartbeat is actually 72 in 1 minute, so we per complete cardiac cycle it will get 0.8 second. In that 0.8 second, only and only atrial systole occurring during the 0.1 second, and rest of the time the atria are in diastole stage. So 0.7 second they are in diastole phase. So when ideally we can see just only the atrial pressure is increasing during the atrial systole or decreasing all the phase during the diastole, but it's not there. So what are these wave pattern we get just reflecting the pressure of the atria? So first thing, A wave, it will occur when there is a atrial systole. Okay, fine. So A wave occurs when there is a atrial contraction is there and there is a increased pressure into the vena cava and it will be reflected into the internal jugular vein. Then we get the A. So after the completing the systole, why we get the C wave? After the atrial systole, the ventricle systole starts. So as soon as the ventricle systole starts, these tricuspid valve will close down and the pulmonary semilunar valve will be opened up. So here, as soon as they closed up and they bulge into the right atria, so as soon as they bulge, it will produce the positive pressure into the atria and we will get a positive C wave into the JVP. Okay, fine. When there will be the V wave then. So V wave we get actually because of the venous filling, V for venous filling. So the valves are closed and the atriums are filled up, so their pressure will also go up. That we get the V wave. Okay, fine. Now, so we all now know when there will be the positive waves into the jugular venous pulse. A wave, there will be appearance because of the atrial systole. C wave occurs because of the tricuspid valve bulge into the atria. V wave, it will appear because of the fast venous filling, which will increase the pressure inside the atria. Now, when there will be the descent. So, descent obviously it will appear when the blood pressure or pressure inside the atria will be reduced. So when there will be the AX descent, so after the systole, the atria starts relax. So that relaxation will create a negative pressure and it will result into the AX descent. And well, there will be the VY descent. So after the venous filling of the atria, actually the blood is rapidly going into the ventricle and which will result into the VY descent. So in these we can say VY appears, yes, because of the filling from the blood from the right atrium to the right ventricle, that is right. YA ascent actually occurs when there is a filling of the right atria from to the vena cava, that is also right. AX descent because of the atrial relaxation, that is also right, that we also have discussed. So first descent occurs because of the atrial relaxation, the second descent appears because of the filling of the right atrium from to the right ventricle. So here C wave is wrong because atrial systole will result into the A wave and not the C wave. C wave only appears when there is a bulging of the tricuspid valve into the atria because of the ventricular systole. Now the next question is, C wave in the JVP is due to what? So just we have discussed C wave into the JVP is because of what? So C wave occurs because of a tricuspid valve bulging into the right atrium. 3 positive wave and the 2 negative waves. Okay, so C appears, C for because of the cusp. Which cusp? Tricuspid valve cusp. During the ventricular systole, the pulmonary trunk valves, semilunar valves open up, but that tricuspid valve bulge into the atria, which create the positive pressure and which will be reflected into the JVP. Atrial contraction will result into the A wave. Right atrial filling actually results into the V wave, and rapid ventricular filling will result into the VY descent over here.